All right, begin.
What's going on, YouTube, and welcome back to the channel. I hope you guys are having a great day so far. So I wanted to touch on this story because this story has hit home for me. I have a story that I'm going to tell pretty shortly as soon as everything calms down within our family and we gain some type of peace and we're able to cope with what we've been faced with and our significant loss in our family. It's just a sad time right now. And it's definitely a sad time for many African Americans who seek to get medical help when they're faced with the pandemic, when they've been hit by the pandemic, the C word. You know, there are a lot of things that African Americans are not getting as far as treatment goes when they go to the hospital. So this lady by the name of Dr. Susan Moore came down with the C word, and basically there was a lot of things that transpired in her stay. Now, she was complaining about being in pain. She was saying that there was not enough of a nurse presence, you know, during the day while she was in pain, while she was laying up in her hospital bed in pain, and that they would rarely come in there. Now, I want to play you a clip of Dr. Susan Moore actually talking about the situation that she was faced with. And I'm going to play the whole 7 minutes because I want you guys to hear this in its totality. So I want to thank you guys for being patient enough to watch this clip in its entirety. I know it's a long clip, but she deserves it. All right. So sit tight. Here's the clip and then I'll be back.
This is the second worst day here at HUE North. Yesterday, Dr. Bannock, Bannec, wanted to send me home. At that time, I'd only received 2 treatments of the remdesivir. He said, you don't need it. You're not even short of breath. I said, yes, I am. Then he went on to say, you don't qualify. I must have, because I've gotten 2 treatments. And then he further stated, you should just go home right now. And I don't feel comfortable giving you any more narcotics. I was in so much pain from my neck. My neck hurt so bad. I was crushed. He made me feel like I was a drug addict. And he knew I was a physician. I don't take narcotics. I was hurting. So I spoke to patient advocate who left me wanting. There's not much I can do. So I started asking, send me to another hospital where they can treat me. And if they're not going to treat me here properly, send me to another hospital. Well, next thing I know, I'm getting a stat CT of my neck with and without contrast. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, yes, we'll treat your pain. You have to show proof that you have something wrong with you in order for you to get the medicine. I put forward and I maintain, if that was white, I wouldn't have to go through that. And that man never came back and apologized. This Dr. Banny guy. And then today now, supposed to be getting the narcotics, right? They came in 9 o'clock. I've been in pain since 7. And when they came in, very, very sympathetic. Yeah, we will get you pain medicine. I don't want to give you IV narcotics. How about PO? Fine. I just want my pain to end. So then he says, well, what pain medicine? I said, I don't know. I don't take them on a regular basis. I don't even write for them. All I know is that I'm in intense pain, and morphine worked. Okay, well, we'll give you Percocet. Okay? I don't know nothing about it. I don't think I've ever had it. It was another 2.5 hours before I got the pain medicine. The nurse came in, with the first thing I said to that nurse was, why did I have to wait for so long? The nurse snapped back, well, you're not my only patient. I have 5 other patients, you know. I said, I have been in pain since 7 a.m., you know. Well, I can't be in here every 5 minutes. I said, no, you were in here once in 4 hours. What? I was in here an hour and a half to 2 hours ago. That was once, since your shift started at 7. Well, I had other people, and I had to take the shift change. I had to give report. I'm a patient. Are you going to take care of me or not? And he went in. Now, that is not how you treat patients. Period. So, I don't trust this hospital, and I'm asking to be transferred. These people wanted to send me home with new pulmonary infiltrates and all kind of lymphadenopathy in my neck. The other thing that white Dr. Bannock said was that if I stayed, that he would send me home Saturday at 10 p.m. in the dark. Who does that? On a week, who does that? And that nurse was telling me, oh, I was marching in Black Lives Matter. I told her, no, I don't believe none of that. Not one bit. Not one iota. He wouldn't even know how to march. Probably can't even spell it. This is how black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place. And he gladly told me, I know you're a doctor. And he didn't want the black doctor to have no medicine, nothing. And then had the nerve to say it's because of him, the nurse, that I got the medicine. Really? Because of you? No. How about because I had that stat CT in my neck, where it showed all of that lymphadenopathy and infiltrates? Yeah, you didn't know about that? You didn't get that in report? That's what I said. To being black up in here, this is what happened.
All right, so you heard what Dr. Moore had to say in regards to her stay and how she was treated at the Indiana University Hospital. And it's sad that this woman was begging for meds because she was in so much pain, and it seems like they neglected her. Let's just keep it all the way 100. So after Dr. Susan Moore was released, she actually had to go back into the emergency room. And this time she checked into a hospital in Carmel, Indiana, I believe. That's how you pronounce the name. because her temperature had rose to 103 degrees and her blood pressure dropped. And I believe her blood pressure read 80/60 and she had a heart rate of 132. So this beloved sister was sick and she wasn't lying about feeling bad, and upon the fact that they did a chest x-ray, she felt that something wasn't right. So she had to beg another doctor, a night shift doctor, to actually get a chest scan, a CT scan of her chest. And then that's when they found that her mediastinal lymph nodes were swollen. They were enlarged, rather. Now, the whole time she was at Indiana University Hospital, you have Dr. Bannock here, who's responsible for neglecting Dr. Susan Moore. And it's so sad that there was no mutual respect for her just being a doctor. People on the other side always like to say that we don't work hard, that we don't strap up our boots, and we're lazy. But here you have an accomplished African-American woman who's a doctor, and she's getting treated like she's a nobody. She's getting treated like she's a nobody, telling her that she doesn't qualify. How about just have some mutual respect for this woman and her actual grind to get to where she was in her life as being a doctor? And to be honest, it doesn't even matter that she was a doctor. Just have some respect for your profession and do your job and treat everyone fair, no matter what their profession entails. I bet you if it was a doctor, of a different hue, right? They would have gotten the proper treatment. They would have been giving everything, even if they didn't qualify for it. They would have been given everything to help them possibly live. And it's just a sad, sad situation that this woman had to go through this. Now, Dr. Susan did update her stay at the Carmel, Indiana location, where she had to go back to the emergency room, where I just previously explained that her blood pressure dropped and, her temperature went up. And as far as the care that she was receiving at this particular hospital, everything was going fine, but unfortunately, she lost her life. Now, what we have going on right now is that Dr. Susan hasn't even been cold for a week yet. She passed this Sunday. And you have the university president of Indiana University Hospital, Dennis Murphy, saying that Dr. Susan was difficult and that she intimidated the staff. Now, in other words, in my estimation, he's trying to say that she was an angry black woman. That's how I'm taking it, because there's a difference from someone being knowledgeable about their profession and how they should be treated because she was a doctor, than someone actually being difficult, even when you're doing everything that you were supposed to do, which you weren't. I've come to the conclusion that Dr. Bannock and Dennis Murphy, they have no moral compass. They don't respect women. They don't respect women of color. And for him to make this statement only 2 days after this woman has passed, this is despicable and deplorable. And in my estimation, he needs to resign. He needs to step down. There's always some excuse of why people with the same hue as me get the short end of the stick. Either we're too difficult, we're too lazy, or we're too dramatic, we're over the top. It's just always an excuse of why we always get the short end of the stick, instead of them taking responsibility and doing an investigation of how this patient was actually handled. Say if she was difficult, the doctors shouldn't have treated her, the doctor and Dr. Bannock shouldn't have treated her like that. You're supposed to listen to your patient. You're supposed to provide top-notch care for your patient. It seems like he was trying to discredit everything that Dr. Susan Moore was saying that she was feeling. And in my estimation, I think that they didn't like that they had a strong sister in there that knew what she was talking about, that stood her ground, and she was asking for things that normal patients with the same hue as me may not be privy to ask, because we're not knowledgeable enough to know what we need to ask for if we're in that situation. So, and for her to say that she felt that she was a drug addict, or that the doctor made her feel like a drug addict because she was asking for something to numb the pain, It's just sad on so many levels. You know, you have this woman that is being told that she doesn't qualify for certain things. Well, how many times do we have to hear? How many times do our people have to hear that we don't qualify for something? You know, it's just sad. Now, I'm just going to go ahead and say this. I feel that she was neglected. I feel that they were intimidated by her smarts, by her strength and her courage, and it turned them off. Imagine having another doctor care for you and you're a doctor, but they don't want to listen to what you're saying. And so basically, every time you try to go down this avenue to get this done, they're closing the door on you. They want to say what you don't qualify for. They want to say, oh, we didn't see this on the chest x-ray. Then you got to beg for a CT scan of your chest. You're just begging and pleading for them to do everything possible to save your life. And it seems that Miss Susan, Dr. Susan rather, was actually working harder to save her own life than the doctors were. I mean, they actually said about Dr. Susan in regards to her the same thing they said about Monique. I mean, is this Hollywood? Was Dr. Susan a professional athlete? You normally hear those terms where, oh, they're too difficult to work with. I mean, they actually said that. Dennis Murphy actually said that Dr. Susan was difficult to work with after this woman passed just this Sunday. Just this Sunday. This is appalling on so many levels. And mind you, this is a hospital that is supposed to take care of their patients, saying that someone is difficult. We know that there have been patients that have been irate, but to come out and actually state that is so unprofessional. As a doctor, as a hospital, you have one job only, and that's to take care of your patients to the highest magnitude that you possibly can, despite their attitude, despite a doctor being knowledgeable enough to call you out on your mishaps and you don't like it. So in retrospect, because you have a smart doctor in there that called you out, that's reason enough to neglect her, the extra care and the help that she needs. Man, wow. Guys, I'm going to let this go right here. Y'all be good. Y'all be easy. I'll be coming out with a video soon in regards to my own situation. And, you know, it's going to be something to hear. Okay? It's going to be something to hear. All right, guys, be blessed. Talk to you soon. Peace.